Aloha, guys. This is Dr. Tom coming at you from back from in Hawaii again. Yes, I was in Florida for several weeks visiting family, but I'm back to the islands now. Okay, we're going to talk about the muscular system today. So, without further ado, there it is. See, that proves it. Chapter goals. I usually don't say them, but today, define terms relating to the structure and function of muscles. Analyze the combining forms, prefixes, suffixes used to describe muscles, explain various muscular disease conditions. Okay, I'm tired of doing that. Hold on just a moment, see if I can. Okay, the muscular system are the muscles of the body. Muscles give us internal and external movement. And also tendons are the connective tissue structures that connect muscles to bones. The best known one is the Achilles tendon in the back of just above our heel. All right, now, there are three kinds of muscles in the body. This is important. I don't like the way they do this, and I'm the one that did the PowerPoint. I changed it. I edited it. Okay, there's skeletal muscle, smooth muscle, and cardiac muscle. They have chosen to call skeletal muscle striated. But that's misleading because we're going to find out that cardiac muscle is also striated. So let's pretend this word striated is skeletal. So there's skeletal muscle, smooth muscle, and cardiac muscle. Skeletal muscle is under voluntary control. It's the only one that is. We can move our bones and our face and when we want to. Smooth muscle, guys, lines many of our organs and other structures, and that is not under voluntary control. They move internal organs, digestive tract, blood vessels, ducts of glands. And then cardiac muscle. Now, you know by now, cardiac means heart. The heart is composed of a unique muscle that's different than all the other muscles in the body. But it's also striated. Now, shortly here, we'll learn what that means. Okay, here's a pretty good drawing of it. Let's see. Striations, guys, are these little marks here. Here we see them. So here's skeletal muscle. Again, I wish they would call it skeletal, not striated. That's very misleading. Here's smooth muscle, which is not striated. And here's cardiac muscle, which is striated. It means it's got these stripes in it. That's all it means. Of these three muscles, only one is voluntary. Which one is it? The skeletal muscle. Okay, muscles have an extensive membrane system. It wraps around them and all down through them and bundles them, makes them into bundles, and then makes into a big muscle. And that is called fascia. It's also called myofascia. Very commonly. So this is the root word for fascia. Fibro means fibrous. We know something's fibrous if it has a toughness about it. Leiomyo, smooth muscle. A little less common term, but yeah. Myo is the root word for muscle, so that's obviously real important. Myocardial, of course, has to do with the heart muscle. Very important term. Heart attacks and strokes, guys, are the leading cause of death in the United States. Have been for a long time. Myos is also another term for muscle that's used some too. The sole of the foot, the bottom of your foot, is called the plantar surface. Plantar. So planto, for some reason they put that in here now. Rhabdomyoskeletal muscle connecting to bones. Yeah, we'll just leave it at that. It is not a common term, but sarco, muscles and flesh, a general term. It basically means flesh, but I don't want to contradict this stuff too much, guys, because the tests and all for the course are based on this, and they're prepared by the same people, the Elsevier publisher. So, I don't want to tell you something that might make you answer the question incorrectly, okay? Asthenia is a lack of strength. Asthenia. These are suffixes, by the way. Asthenia. I'm trying to think of a term. If you have a wasting away or for some reason you don't have normal strength. Trophy means development or nourishment. Atrophy is when something deteriorates or shrinks or wastes away. Atrophy. Maybe that'll help you. A lot of you have maybe heard that term. Prefixes. Okay, we're going to learn directions in the body here in a few minutes, movements. And these first two are real important. Ab means away from the midline or something, but usually it means the midline. Ad means towards. How do you remember this? Now we're going to go in this in some more detail. Because the B is facing away from the A, and you remember ad is towards because the D is facing the A. Now guys, that's the same way I learned it 30-something years ago. Dorsa, back, the dorsal area. We know that poly means many or much. Okay, skeletal muscle. Here's some of them. More detail in anatomy. But here's the names of the muscles around the eye, and some of them, like the masseter muscle, is a big one we use for chewing. These big neck muscles here are called SCMs. And the reason they're called that, because the real name is sternocleidomastoideus. Do you want to say that all the time? Okay. And they rotate the head around. The pecs, we're all familiar with those. The biceps. Here's the butt, the gluteus maximus, the hamstrings, the calf muscles. Look over these and get a little feel for them, but you'll go over it in real detail in anatomy. Okay, action muscles. All this stuff here, guys, is super important, and you must learn it. Super important. Flexion reduces the angle in a joint. So, for example, this is flexion of the elbow. Straightening it out is extension of the elbow. Okay? This is flexion of the neck. This is extension of the neck. This is flexion of the wrist. This is extension of the wrist. Okay, you got to know that. All right, now, what did we say? AB, abduction, moves away from the midline. How do we know the B is facing away from the A? Adduction moves towards the midline. How do we know the D is facing towards the A? So, if this is, I don't know if we can get this in the shot here. This is abduction of my arm. Abduction. This moving towards the midline is adduction. We must know these. Rotation. Like the neck, for example. Not all joints can rotate, but the neck and the back can. Okay, if you bend your toes up, that's called dorsiflexion. Because the top of the foot is called the dorsal surface. Plantar flexion is if you point your toes down. Toes point towards the ground. Remember we said the bottom of the foot, the sole of the foot, is called the plantar surface. Supination is the word for the palm being facing up. Pronation is the word for the palm facing down. Supination, pronation. So yeah, you need to know all these for sure. You'll go over these in anatomy as well, of course. Okay, here's pretty good drawings of them. Let's see. So here's abduction away from the midline. Here's adduction towards it. Rotation, flexion, extension. Dorsiflexion, plantar flexion. Supination, pronation. Mainly of the forearm, but it is true that if your ankle bends in, it's supination, and if it bends outward, it's pronation. Those terms, however, though, guys, are primarily used most of the time for the hand. All right, let's see what we got for vocabulary. Abduction, we know, is movement away from the midline. Adduction, movement towards. Dorsiflexion, point the toes up. Extension, straightening of a flexed limb. This is misleading. It's not just the limb, because you can flex at the waist, you can extend at the waist. So there's a lot of joints in the body that demonstrate extension that are not the arms and legs. Fascia, we talked about that. Fibrous membrane separating and enveloping muscles. That's a good definition. Flexion, downward movement of the foot. That is absolutely freaking incorrect. Dorsiflexion is downward movement, or plantar flexion. Flexion is this, or this, or this. I don't know. I thought I did these, and I would have caught something like that. I don't know. Okay, insertion of a muscle, connection of the muscle to the bone that it moves. Okay. Origin of the muscle is connection of the muscle to the stationary bone. For example, the biceps has two heads. That's why it's called bi. The origin is up here on the acromioclavicular area, and it inserts down here. I believe it's on the radius, the forearm bone. Plantar flexion, pointing the foot down. Pronation, palm up. Rotation, circular movement around a central point. Skeletal muscle, well, now they finally said it. Muscle connected to bone, voluntary or striated muscle. Okay. Guys, I'm not, when I, some of this stuff now I know I act, and I do it on purpose, offended or like I'm, oh, it's outrageous. And it is. I mean, it should have been called skeletal muscle all along. Striation is one quality of skeletal muscle. But as I said, the cardiac muscle is striated also. Smooth muscle, visceral muscle, yeah, lines, organs, and stuff. Striated muscle, skeletal muscle, but it's also cardiac muscle. Supination, palm upward, yeah. Visceral muscle, muscle connected to internal organs, yeah, of course, would be smooth muscle. Visceral always has something to do with organs. Pathology, more detail in anatomy. Muscular dystrophy, inherited disease with progressive weakness and degeneration that's not related to the nerves, it's in the muscles themselves. Polymyositis, autoimmune disease, disorder with chronic inflammatory myopathy. Now, myo means muscle, opathy means the disease of. So these autoimmune diseases, guys, are hard to deal with. You can give drugs to weaken the immune system, and then you open up another can of worms. Laboratory tests, more detail, AMP, anti-nuclear antibody test. I don't know what that is. ESR, this is an important one. Erythrocyte sedimentation rate shows how quickly red blood cells settle out in a sample. It's used to measure inflammation. Rheumatoid factors for rheumatoid arthritis, a very serious autoimmune type of arthritis. Serum calcium, well, the chemical word abbreviation for calcium. Serum creatine kinase has to do with muscular problems. Uric acid, I really don't know why they put that in there, but that's a measure of kidney function. So I'm questioning why they would put that there. Arthrocentesis is when they draw fluid off a joint to analyze it. Arthrography is when they visualize a joint with various, like an MRI or something. Arthroplasty is when they would surgically work on a joint. Arthroscopy, if you've heard an athlete say, oh yeah, man, I got to go in and have my knee scoped out. They make incisions, they put the scope in there and look around. CAT scans or CT scans are super x-rays that show soft tissues. Discography is to visualize the discs in the spine. Electromyography measures the functioning of muscles. MRIs are another real important medical imaging. They use strong magnetic fields and radio waves to visualize tissue. Them and the CT scans are quite important. Muscle biopsies, where they would actually go in and cut a piece of it out for analysis. Abbreviation. Now, some of these things, guys, you're not going to see much. AC joints, acromioclavicular joints are right here. ACL, anterior cruciate ligament of the knee, one athletes injure quite frequently. Anti-nuclear antibody, I don't recall what that is, just to be honest with you. Below knee amputation, yeah, but I don't know when you're going to see that. Calcium, creatinine kinase, CMC, carpal metacarpal joint would be right in here. These joints where the carpal bones of the wrist and the metacarpals join. I'm not familiar with that. Term, but yeah, you have to know it for tests. Okay. Dual energy X-ray absorptiometry, have no idea. Disease modifying anti-rheumatic drug would be something to help rheumatism and possibly rheumatic joint problems. Okay, I was hoping we could finish, but I don't think we're going to be able to. DO is a doctor of osteopathy. Now, there's MDs and there's doctors of osteopathy and there's doctors of chiropractic, which is what I am. DOs are pretty much online with MDs anymore. They do the specialties. I think they're excellent doctors. So the only way you know if your doctor is an osteopath or not, they have DO after their name on their jacket or shirt instead of MD. Deep tendon reflexes is like when they tap with the rubber hammer. Electromyography measures electrolytic function of muscle. We mentioned this one a moment ago. SED rate. It's also called SED rate. All right, we're running out of time. Dr. Tom signing off. We'll have to continue in a second one.